432-2303 for an appointment.
Go back first and talk about what arthritis is.
Sure. Arthritis, by its name, is inflammation of the joint. That's what arthritis. Arthros is the joint, itis is inflammation.
Okay.
But it's really a word that we describe for a number of different processes. There's different kinds of arthritides. So, for example, the one that we most commonly think about is inflammatory.
Okay.
In other words, that the body is somehow attacking the lining of the joint. The joint has surfaces and they have tissues inside called the synovia. And for whatever reason, our immune system goes after that and kind of attacks it and inflames it. And it can cause it to be red and hot and swollen. And we see people have those deformed fingers and gnarly and stuff. That's the classic kind. That's called rheumatoid arthritis. And it's sort of the most common one of inflammatory arthritis.
What is the feeling of pain like from within that type?
Well, it varies. Every person has a different feeling, but it's obviously quite painful, and you can get stiffness and all that. But classically has the hot, inflamed joints.
Okay.
Now, there are other diseases that also create inflammatory arthritises.
Okay.
There's systemic lupus, for example, Sjogren's syndrome. There are other inflammatory arthritis. They form one group, autoimmune. We're attacking ourselves. Inflamed can cause destruction, can cause deformity, and that varies in degree, but that's kind of that group. And then there's also, within a subgroup of that, would be the infective arthritis. We don't see those too much, where somebody gets infection, and the bugs go to the joint, and we get an infection of that, literally a bacterial infection in the joint. It's kind of a subgroup, but one that's there. Not usually what we see. It's not a chronic arthritis.
Okay.
Then you have what we call degenerative arthritises.
Okay.
That for some reason, the wear and tear, their fluids and the way that they've used it over the years has worn that joint down, degenerative, and you get certain kinds of pain and also some stiffness, and sometimes you get occasionally changes in structure. But they're not inflammatory per se.
Okay.
But you can get some significant problems with that. And they may attack different joints, depending on use and unique genetics. So someone's lifestyle might lend them to have degenerative disease of the hips or the knees or the shoulders, depending on what you do. Football
Are you
players.
literally having a situation where there's some grinding going on?
Well, you can have some grinding, absolutely. That'd be a form of degenerative arthritis where the bones no longer have the space in there. And they call osteoarthritis, in which you kind of have depositions of calcium and bone stuff around the joint and in the tendons and things, and you get stiff and sore, but it's more around the joint, not in the joint.
Okay.
In a sense. You can have some in the joint too, but mostly it's around it. Now there are other conditions that create pain around the joints that aren't really in the joint also. There's a thing called polymyalgia rheumatica, for example, in which the soft tissues that support the joint get inflamed. So the joint actually is made up of two bones. Then you have these ligaments that help keep them in place, someplace. Then you have various muscle groups and tendons that cross over the joints that give the motion. So for example, on my arm, we have the elbow joint, and if you can see, it's a muscle here, and in here is a tendon. You can see it kind of come up there, right there.
Okay.
It's hard. Now, this joint is two bones. If they weren't sort of held together, they would just be lying separately on the floor, basically.
Right.
But we have these things, these fibrous tissue bands called ligaments that kind of keep it all, at least in local proximity, in the right place.
Okay.
But joints facilitate movement, and that movement has to do with a muscle body sending a little rope called a tendon across the joint. So when this muscle contracts, something comes up. Now, in here, the muscles for the hand are here. The muscles for the to move the forearm is here.
Okay.
All right? And then we have joints here. So the muscle that will raise this joint has to be here, and the tendon crosses over, and it goes up, right? And so the muscles that, for the most part, cause this motion are under here. There's some under here, too, but I want to make it simple for everybody.
Okay.
So we have a joint's made up of a number of different structures. So arthritis is an inflammation with perhaps in that joint, or, as I talked about, some of the bony structures around it, and sometimes the ligaments get calcified, and all kinds of things occur.
So would I be wrong if I were to speculate that there are so many different types that seem to come from different reasons that treatment
Well, we'll get to treatment in a moment.
very different?
Yes and no. Yes and no.
Okay.
The basic approach is, in traditional Western medicine, anti-inflammation. Because even in degenerative, it's inflamed. It means hurting, a little bit rubbing, some soreness, soft tissues may be a little bit off, so there's still a degree of pain and inflammation. And so the basic approaches are anti-inflammatory. So we have, aspirin, it's a great anti-inflammatory, and its cousins, the Advils, the Nuprins, the Toradols, and there's a whole slew of these things. Relafin, all these things are non-steroidal anti-inflammatories. Why they're called that? Because the one step up on power of inflammation is to suppress the entire immune system's reaction. Because after all, what is inflammation? Inflammation is our own system doing something. It's a healing process. So it's kind of gone amok, you might say, and so we block it. So steroids, these things produced by the adrenal glands, I'm not going to go on, we don't have time for the show to go into great detail about it, are like what our body makes when we need it to help out on things. So when we give steroids by pill, we shut down, we block all those immune reactions. Now, there's some major consequences to that, but that's kind of what goes on. So, but that sometimes that has such significant systemic side effects. I mean, it weakens our bones, and it can make us more susceptible to infection, and it makes us gain weight, and liquid, and hypertension, and diabetes, all these things come from steroids. There's actually a whole nother, even different kind of drugs that interfere, because the problem is you can get real destruction of joints. This inflammation can eat a joint up. So there's other groups now. There's stuff called methotrexate. It's a drug that was been known for many years that interferes with kind of the division of cells, you might say. And so that also works. And there's some other stuff, too. We won't go into all of them. But, the area of rheumatology, a rheumatologist is a person who's a physician who has specialized in these kinds of disorders, which, by the way, are not just in the joints. Sometimes they have other sites of action. For example, you can have rheumatoid arthritis that affects the heart. That same process could affect the heart.
Okay.
So just to let people know that arthritis sometimes is a manifestation of a whole process going on inside of us. So anti-inflammatories of differing strengths and ways in which they do their job is basically the hallmark of traditional Western treatment.
I have to tell you, though, this sounds like it's going to be a toughie for non-traditional treatment. This sounds like something that is extremely, since it is a physical site that is being debilitated, then there are physical changes in that site. This sounds like a tough one.
Well, it can be, even for the people who are treating it with Western drugs. It can be very aggressive, and it can start out very early. There's a form called juvenile rheumatoid arthritis, where kids get it quite young.
Yeah.
I have a family who's come to see me that the mother had it, the son has had it, quite young, and it can have quite significant consequences. It's a long story. I'm not here to do a whole treatise on this, but there are varying degrees of inflammation, and a lot of very fine physicians and people have been working long and continue to work long hours to try and find a way to stop this, and find less toxic ways of addressing this, what can be a very aggressive inflammatory process. So then we have to ask ourselves, well, is there, from the other side, ways that we can think differently, and perhaps apply some approaches that may also help, that may be less toxic, and maybe just as helpful in some situations, either to help the process go away, or to really cut down on symptoms significantly, so that perhaps less drugs, if any drugs are needed. And I'll tell you a few stories as we go along.
Okay, you know what I wanted to ask you though?
Sure.
Have they found a link between, now obviously when you talked about the family that came in, where everybody in the family,
Well,
all the
everybody.
different generations,
Certainly
we
it
can
was
see there's a
multiple
genetic link there.
Yes.
But are there also, okay, there's a genetic link in my family for mature onset diabetes, but if I watch my diet, I have a very good chance of not incurring mature onset diabetes. Is there, has there been a causal link found? I mean, other than genetics?
Yes, there are certainly some questions of, for example, there are some people who feel that there is an occult infection. For example, there's a group that feels that a bug called mycoplasma is involved, and they put people on long-term antibiotics, and many of these people get their arthritis get better.
Interesting.
Right. We know, for example, Lyme's disease, which is caused by a little special kind of a organism from ticks, that if left unchecked, our immune system will create arthritis from that, an infection from that as well.
But have they discovered any, I'm sure there's no research going on in this area, but any dietary links, eating too much salt or
Well, I think that there probably are. I'm not going to tell you that I'm up on every nuance of what's being done in the area of research in traditional science in the area of rheumatoid arthritis. But as a rule, most of the Western rheumatology approaches do not link diet per se to the quality or presenting picture of arthritis.
Okay, I'm going to stop you right there because we're going to be back in a minute to discuss a little more of this and a little bit about how people who work in your area look at arthritis.
You bet.
Thanks.
Have you ever wanted to make a difference but didn't know where to start? I'm Maria Hernandez Ferrier, your host for City Spirit City Year. Join us every week as we talk about the wonderful things that are happening in San Antonio and how you can join in and make a difference.
The Deaf and Hard of Hearing Ministry for the Archdiocese of San Antonio offers religious education classes for deaf children on the second and fourth Sundays of every month at San Francesco de Paolo Catholic Church. The Deaf Ministry is funded by the generous support of the Knights of Columbus. For more information, please call 342-1500.
Dr. Cohen, so now I want to pick up where we left off, and we were at the point of you talking to us a little bit about how homeopathy looks at arthritis.
Well, not homeopathy. We'll talk about homeopathy
I keep
in a minute.
mispronouncing it.
Homeopathy is a specific intervention, but how the sort of the overall natural or alternative approach might approach it.
Okay.
Well, let's talk about a few things. Let's talk about some things that, for example, let's talk about aligning. Nutritionally, for example, there have been studies in Europe that show that a substance called glucosamine sulfate.
Glucosamine sulfate.
Glucosamine sulfate, when given over a period of 12 weeks, in a statistically significant group, had the same degree of relief and better as those people using a non-steroidal anti-inflammatory.
Okay.
In certain groups.
And what is glucosamine
It's a nutritional
sulfate?
supplement. It has to do with, it's a component of what the body uses to make cartilage.
Okay.
Make it simple
Oh,
that
okay.
way. So here's one thing. Another thing, there is an inflammatory pathway, a cascade in our systems. It has to do with certain fatty acids called the arachidonic and prostaglandin system. Interestingly, certain fatty acids, specifically those in fish oils, called omega-3s seem to change and block that inflammatory pathway.
Okay.
So in some people, when you put them on therapeutic doses of fish oils, fatty acids,
And what would a therapeutic dose be? A lot?
well, could be as much as 1,000 milligrams of what they call EPA-DHA.
Okay.
I'm not going to go into names, it's hard to pronounce them.
Well, there's also a toxicity with
In too much, you can get bleeding problems, yes.
Okay,
Yeah.
all right.
But this is the same stuff they use for heart patients, where they have said that this is helpful in the area of working with people who develop plaque in their arteries. And also, by the way, it's also helpful for the brain. Fish oils have a lot of very interesting, exciting aspects to that. So that's another area. Then there's the area of herbs. There's ginger and turmeric, and to some extent the digestive enzyme bromelain.
Okay, I have to stop you right there because you said ginger and turmeric, and so I have to ask you, is there a lesser degree of arthritis in the East Indian population?
I don't know the answer to this.
Wouldn't that be an
It would be an
interesting
interesting
study?
question, very interesting question. And some other stuff called baswala that they're showing has tremendous good value in helping people with the inflammatory pain and problems of arthritis.
So you said ginger, turmeric, baswala, and one more. Before the baswala, you mentioned another one. And I'll
I
get it
can't
from you
remember.
later. That's okay.
But
Go on.
the point is that these are on the shelves,
Okay.
and people can find out about them. So there's herbs, there are nutritional supplements that can nourish and seem to change that inflammatory pathway. Now, there are also a lot of other interesting things in the area of supplements and in nutrition, in the area of nitrous oxide, antioxidants, and I'm not going to, it's a complicated story, but there's some question where even there are other antioxidants that might be helpful as well in working with people who have arthritis and the prevention of arthritis and those who might develop it. But I want to move on a little bit also and look at the nature of some other things that might also play a role.
Okay.
If we are eating in such a way that our immune system is overstimulated, then the general inflammatory process will be kind of heightened. Let me give you a very simple example. You go to work every day. 30 people are in your office. 10 of them are very irritating. Now, when you go to work with those people, you can take some of your energy and deal with them. But over time, it's going to drain you a little bit. And come home, you're going to kick the dog, yell at your kids, the whole thing. But you can deal with it. Now, what happens when those 10 people are transferred to another building? You relax. Life is better. You calm down. Your whole system quiets. Well, there's some of us who have witnessed and believe that there are food allergies, foods that we eat. We don't even know about it. That when we eat them, our immune system's a little tweaked, you know, and it's just constantly a little cranked up about it. And so there are blood tests, for example, that one can do to find out what those foods are, and you can get off them.
And sadly enough, my sparse knowledge on this, I happen to know that so many people are allergic to things that are so prevalent, like wheat.
Oh, corn.
You know, yeah, and
Yeah, you do
that's
these
just
tests.
incredible.
I tell people before you do this test, be prepared.
Yeah.
Because when I did mine, I couldn't have tomatoes, I couldn't have lemon. You try to get tomatoes and lemon out of your diet. Now that's not as bad, and I had chocolate and a few other things too, as people who can't have corn.
Yeah.
Because corn is in sweeteners and everything. Or wheat.
Or wheat.
How about if you couldn't have garlic and onions, right?
Yeah, there you
I mean,
go.
you really say, I'm not doing this, Dr. Cohen. Well, then don't spend the money. So that's what I say. It's expensive test, but helpful. Now, additionally, there's the whole question of our gut, called leaky gut stuff. We've perhaps taken a lot of anti-inflammatories, and we've altered the permeability of the microscopic membranes between our blood and what we send through our intestines. And so more foreign material, you might say, leaks through. And so what part of our system has to deal with that? Our immune system. And so we may be getting certain bacterial antigens, we call them, little parts of the bacteria in our gut that may be getting in and triggering responses, because there's some interesting information that certain bacteria in our intestines are also there are certain properties of our own joints that look like them. And so maybe our system's getting too attacking this bacteria, and it thinks this is the same thing, and maybe that has something to do with it. So healing the gut becomes a whole other arena as well. And then there's kind of a buildup of residue, of toxicity, of our whole body just being overburdened. And so there's a whole process of that called detoxification, where we get off the foods we shouldn't be eating, cut down how much we eat, we enhance our liver's ability to detoxify. And we find that when we do this, people feel better. I mean, you may have personally experienced sometimes where you ate wrong the night before, you ate too late.
Absolutely.
You're a little stiff in the morning, aren't you?
I don't know about that, but I do feel it in other ways.
Right,
Perhaps,
but some people
stiff
get
in the morning.
stiff.
Yeah.
Well, those people go to the sauna, they work out, and they say loosen up a little bit. These tissues all get kind of full, you know? So sort of getting all this stuff out can also be important. And there are many other things too. There's acupuncture approaches to this. There's all kinds of things because it's a systemic approach. Then there's homeopathy. Homeopathy recognizes that if we can unblock the system's creation of this process altogether, that will stop creating it. And so you find the right homeopathic remedy that fits that person, and you give it. And I'll tell you a quick story. A woman came to me, had many years of severe inflammatory arthritis. 50-year-old woman, accountant, CPA, already was deforming. Very sweet lady. Had been on methotrexate, Cytoxan, steroids, everything for 10 years. Her body was really inflamed. There's this thing called a SED rate, which kind of is a degree, it gives an idea of how inflamed things are. And people classically with these chronic diseases also get anemic. We don't know all the reasons why, but there's too much energy going in inflammation and stops making so much blood, so you get anemic. So she was fed up with all her treatment. She came to see me, took herself off everything. Well, I did the blood test looking at her food allergies. We helped heal up her gut. We put her on a lot of these things that I spoke to you about. And I gave her a homeopathic remedy that I thought fit her. Within a period of months, she really improved. Really improved. Her SED rate, which was normally in the 70s, normally it should be less than 20, came down to normal. Her anemia completely corrected itself. She stopped having inflammation altogether. Even 2 and 3 years later, and 5 years later, she's still stopped creating inflammatory arthritis.
You know,
Now, not everybody gets as dramatic a result. Find the right homeopathic remedy is one of the keys to making it happen. I have other rheumatoid patients who I put on diets and all that, and some have done well with it, and some haven't done as well, but they've done a little better. There are varying degrees of all of this. It's still, we're working with it and trying to find the right tools here. But these people are off these drugs, they're eating better, their overall energy and health improves, and they become healthier as people. You were going to say something, or ask something?
No, I was going to say it sounds like we could even harken back to, you know, the last piece that we did on inner strength and outer support. It's going to take some kind of a looking at oneself and realizing that, you know, you're talking about, for some people, what might be huge changes and the commitment to doing that, to getting off the crutch.
It requires major lifestyle changes. And by the way, there are people who just have spontaneous remissions of their arthritis.
Really?
Yes. This
Might
is
that
known.
be, well, but might that not be something having to do with the mind? Well, we
Might,
don't really.
might that have something to do with the mind?
You just managed to make me sound so ridiculously ignorant in this area. But in any
No, but
case,
I mean,
I
you
would think that what appears to be spontaneous is actually something that's not spontaneous at all, but caused by something happening here.
There's some connection in our mind, body, place. It's the way you phrased it. It was what I was getting at. Might it be? Well, I think probably. It's all that's left there. You know? But the twin thing, we were talking about the twins and the infection. Same idea. That there's something about who we are, and I don't pretend that I can so crystally present this.
The mystery of life.
The mystery of life. But there's something about us that if we change in some way, we stop manifesting what we have.
Even if that change is solely in the mind. Beginning in the mind.
Thank you.
Thank you.
Even
Ending
if,
with-
absolutely, for sure, has to be there. In fact, you know, sometimes we can get the right stuff to make it happen. But the fact that there's something that gets us here and something that can get us out of here, that's really, there's some wonderfulness there. But until we all can get to that place, there's some really good, healthy approaches to dealing with arthritis, along with exercise and movement and a number of other things as well.
And you know, the horrible catch-22 of arthritis and exercise and movement is that, of course, if you're feeling that pain, and we know that in order to exercise we need our joints, it's almost like going toward the fire to even use the joint to begin with. You know, you're doing movement and you're many times finding it painful, at least initially. And so it's, you know, I would think that if someone has arthritis that really is painful, that exercising is the last thing that's on their mind.
Right, and that may not be what they can do right now, but they can be moved in that direction.
Right. Well, again, little by little by little, perhaps even starting in therapy,
Right.
starting in physical
and
therapy.
it depends what you call exercise. Some things may not really be what you think are exercise, but maybe just correct movements.
Okay. Okay, can we just sum this up a little bit? We have about a minute and a half left. Can we just kind of sum this up in terms of, we know that there are some new treatments. We know that there are herbs. We know that what would you like to say, ending this up, to people who are suffering?
I think that there
A lot of people are suffering.
are real concrete lifestyle and behavioral changes and therapeutic interventions that can have tremendous benefit to the process that we call arthritis in its many forms, and that they can seek them out.
Are there people who are going to be in pain no matter how much they change? Let's say where the degeneration
There may be.
itself has...
There may be.
And
Yes.
then, okay. I just wanted to talk a little bit about pain management for those individuals.
Well, that's a whole other story.
Oh, geez. Well, Dr. Cohen, we will we will see you next week. No, we want to thank you because we know someone who's real special to us right now, and we just want to thank you for your advice.
My pleasure.
Okay. See you next week.